switch gears a little bit. I mentioned that this is the meeting of the annuity fund, the annual meeting of the annuity fund, so the retirement plans, but I will have some slides on our health plan and life disability plans and others. A snapshot on our health and dental plans for 10 years. We have been at or below trend. Trend in healthcare is roughly 8 to 12% a year. So the cost of healthcare, and we all hear it, we all know about it. There's lots of discussion about that. Average is 8 to 12% a year. We've been about half of that, but roughly 4 to 5% in terms of healthcare trend. Healthcare trend is made up of two components. About 1/3 of that is inflation. So the cost of healthcare by inflation represents only 1/3 of trend. 2/3 is utilization. We consume more drugs, we consume more tests, we consume more outpatient surgeries, we consume more inpatient surgeries. And so when you saw the comments that I had on an earlier slide, 150, 160,000 scripts, 220,000 claims, that's double what it was 10 years ago with roughly the same base. So when you think about the cost of health care, there are a number of things that are driving the cost, but among those is that we are consuming more health care. We're taking more drugs and we're going to the doctor more often. And so when you see in healthcare reform discussions about really clinical rules of what is going to be covered, not covered, et cetera, it's really the industry's way of trying to, how are you really controlling the times you go to the doctor, what are the necessary procedures, what are going to be covered, even here in recent weeks in terms of preventative care, what will be covered in terms of times to the doctor, and it's really to get a control of that utilization component of trend, which is what's really driving healthcare costs, is we're just consuming more prescriptions and we're going to the doctor more often. We are generating about $15 million plus in annual savings in the UCC Health plan, largely because of our relationships with others. The utilization of networks, our members use networks, we use generic drugs when available, and our coalitions. You'll see a slide in a minute. On the medical side, we're part of 11 different faith communities that really negotiate contracts for health care with Highmark. On our prescription side, it is 18 different denominations, so we're buying drugs as if we're a group of hundreds of thousands rather than thousands that we have in the plan, and that allows us to save significant dollars, and the $15 million represents what we would have been paying extra in the health care plan had we been just at trend in the last 10 years. So we have been half trend for 10 years, but had we been just at the trend, we would be paying in our aggregate healthcare costs across the plan $15 million more. And an example of rates for 2012, our non-Medicare rate went up 2.3%. That's our active population. Our Medicare rate went up 4.5%. We have really two different plans. There's 10,000 belly buttons, if you will, in the plan that's covered lives. About 4,000 are retirees in one plan, about 6,000 are on the active side, and those belly buttons are located in 860 of the 904 zip codes in the U.S. So we don't have a concentration in any one place. We are scattered all across the U.S. We have a separate subsite of our website that supports our wellness programs, healthystewards.org. And we have an improved effort in our wellness program that has been in place for 8 years that we launched on January 1. And the Medicare Supplement Plan, which is our retiree plan, we began or launched in 2011 a second review of that plan in the last 4 years, and that will be reported to the board at this meeting and reported as part of the annual meeting next year. Just a couple of quick slides. Snapshots, and we received reams of data from our various coalitions. These next two slides really just focus on our contract with Highmark, the various denominations that participate. Southern Baptists are the largest, Presbyterians are we're third, that's UCC, and then it goes down different denominations from there. And it gives you a sense of just contract savings as part of these coalitions with Highmark. You can see that it's tens and tens of millions of dollars in contract savings because we work together with our friends that are Southern Baptists and others in terms of negotiating better and better rates in terms of our health care costs. one of the drivers of healthcare costs that for our plan over the last 3 years is high-cost members. We have been significant for a period of about 26 months. From 2009 through the middle of 2011, we had an extraordinary number of shock claims, high-cost claims, and you'll see among all of our partners, we were really at the top of that, and it's even in the narrative described here that we were the top of all of the group in terms of numbers of high-cost shock claims for that period, and we were able to absorb that in a self-insured world, but still it was quite extraordinary. I'm happy to report since the middle of 2011 our claims experience have reverted back to more of the normal trend over the last 12 months, but it does drive our costs, and one of the benefits of being in a self-insured plan is you can moderate those shock years without having dramatic rises in premium. We've been able to have a level premium base over the years. And this just kind of describes it in more technical language. Prevalence really relates to where we are in terms of our member base. You'll see we're about the oldest of the group here, and you'll see that we are the sickest of the group as it relates to musculoskeletal, hypertension, cholesterol, diabetes, and depression. We are kind of off the scale in all of that in terms of our cost drivers. So our risk pool, and this is on the active side, not on the retired side. I don't think our retirees are as depressed as the active, but it does give a snapshot of what drives our cost, and we have lots and lots of drill down data with respect to healthcare. So the number one question that we receive is, what can we do about the cost of healthcare? Know that we're on it, and we do this in a way that is very effective. Essentially a $70 million operation that we operate for less than 1% in terms of administrative costs and fees attributed to the pension boards. A couple other things that are embedded in the health plan is safety. We get about 200 to 250 safety alerts each year for drug interactions. And so if you're in the UCC Health plan, which many in the room are, unbeknownst to you, behind the scenes, if you have different doctors or multiple doctors prescribing multiple drug therapies, that if there's an interaction, these scripts don't get filled. And behind the scenes, there are alerts that are fired off to the doctors. And again, about 200 to 250 each year do that. And we, because of this particular rule we put in place, save anywhere from 1 to 3 lives per year, but many, many illnesses. And we just each year will pull 2 slides, one from our active, one from our retiree. And here's a 55-year-old, again, that was prescribed what we did, and the outcome kept that prescription from getting filled. And on our retiree plan, an 85-year-old as well. Again, what was the safety issue? And similarly, the script was not filled. So in addition to all the other things we do in terms of administering the plan and wellness and other things, we have a number of safety rules embedded in the plan that are just automatically included. This is a snapshot, and I've been bringing this each year for the last couple of years. This is healthcare reform. And all the complexities of healthcare reform. We're in 2012, moving towards 2014, and we are compliant with all elements of healthcare reform and continue to be, and all that is required, but it is significant as to what we are expected to do from a compliance perspective in healthcare reform. And on this continuum, we are compliant. If there's enough time at the end of the meeting with our Q&A time, I can make a comment about healthcare reform, and particularly the Supreme Court challenge. And that is significant, the employee mandate piece, and I can give some comment on that later if there is time. We also administer a life disability plan for the benefit of our members. We have over 5,000 covered lives that are part of that plan. Those are employees. It's an inexpensive benefit for the whole church. Only 1.5% of salary is the basis for that. So you $50,000 salary, 1.5% of that is $750. And for that $750, you get a long-term disability benefit, a short-term disability benefit, a death benefit. And if you go on long-term disability, you'll see that contributions are made to the annuity plan to age 65, and your health insurance is paid for. That is a product that's not available in the marketplace. It's a safety net for those that serve the church at a very low cost to the church, and it is something that really every employee in the United Church of Christ should have benefit to. We only have 5,000 that are, but to know that this is a significant benefit for safety benefit, because you are more likely to be disabled than to die, and there's a significant risk of something occurring before you are eligible for retirement. And this is a program that if you become long-term disabled in particular, your health care is covered to age 65, and there is continuing contributions to your annuity plan. Flexible spending account, again, this is just one other benefit that we offer to the plan. We have 250 churches that are part of it. If you're in the health plan, there's no charge. It's a way of deferring income and in a different way, and actually would save in 2011 estimated to $182,000 that our members would have paid in federal income tax that they did not have to pay because of their flexible spending accounts. Again, another program offered by the pension boards.